just to introduce myself, I am Dr. Jean Villanueva, and I've been in dental practice for 30 years. So I graduated from CU College of Dentistry here in the Philippines, and I had training in advanced restorative dentistry in University of Chicago. Before we proceed with the edelweiss, I would like initially to tell everyone that I've been a key opinion leader and consultant of edelweiss for almost 7 years already. And I have been using that for a long time, including having it on my lower teeth. As you can see, as you grow older, your lower teeth shows more when you speak rather than your upper. And I'm so happy that I had edelweiss on my lower teeth. And every time I see myself on the video and looking at my nice lower teeth, I'm proud to say that, I did the right thing and have it done by Dr. Stefan. So what is nice about edelweiss? This is a progressive technical concept. Why progressive? Because it was able to improve a material that we have been using for a long time in our clinic and make it different and improve better. Okay, so this is what we call the edelweiss style of dentistry. Now, doctors, I will initially on this lecture, on my lecture, I will teach you how to do the edelweiss system. Now, on the other two speakers, they will show you the clinical cases so that you will have a better understanding how you can apply the material to the actual clinical application. So, what's so special about edelweiss anyway? Okay, so first, of course, as I've said, you need to know the system and know the material very well. So you have a full understanding of what it is. Okay, of course, there is no such thing as a perfect material. But Edelweiss were able to create a system wherein you can use it directly, meaning without, the patient already sitting on your chair, and you can directly bond it. You can do semi-direct, meaning you can, get the impression, do it, while the patient is waiting and then bond it. Or you can do indirect, have somebody or the laboratory do it for you, especially in the posteriors, if you like to create a crown or some sort of uh, improvement of how the system is done, the advanced way of using it, then you can also do indirect. So that is what I like about Edelweiss. You do whatever you want to do. If you want to do it direct, go ahead. If you want to do semi-direct, fine. If you want, not to do anything about it and let somebody else to do it for you, it can be done as well. So another thing that I have to be clear is that this is a laser sintered uh, system, and the end result of the product is vitrified glass. And the main product that it delivers to the dentist is that it is a veneer and an occlusion VD. So what is an occlusion VD? It is actually an onlay. So it is a veneer and an onlay restoration. However, what is nice about this product is that it is very, very flexible. You can do whatever you want to do as long as you understand how the material works. Of course, like any other material, you need to understand what it is. Now, most of the questions that dentists will ask us is, how strong is this? Will it break? Will it, fracture and stuff like that? Now, as you can see, the problem with dentists, as I've said earlier, you need to have the proper attitude and mindset. Okay? So majority of the dentists keeps on comparing apples to oranges, comparing two materials that are totally different in terms of its characteristics and content. It is like comparing metal to wood, something like that. So, right now in dentistry, you might probably have heard the words minimalistic, biomimetic, holistic, all these words. What do they express as a message to all of the dental practitioners? The message is, let us preserve the natural tooth. That is why we became dentists anyway. So, when Dr. Stefan, who is the inventor of edelweiss, started creating edelweiss, he tried to concentrate on what is being a dentist all about. So this means he needs to create a material that can preserve as much of the tooth structure when we are treating it, and second, to have the material that we are going to use as close as possible to the characteristics of the enamel and dentine. Now, as you can see, the different characteristics of enamel and dentine is like, for example, the flexural strength between 60 to 90 megapascal, and the same way as dentine, which is 245 to 280. Now, if you will look at the edelweiss and versus ceramics and zirconium, you will say, oh, ceramics has a higher uh, unit of in terms of strength, or zirconium is even higher. But you see, it doesn't mean that it is stronger or has a higher value, that it is better. Why? Because majority of the time when we do treatment, the opposing tooth is probably a natural tooth. So if your restorative material is harder or is stronger than the natural tooth, if something goes wrong during the function like mastication or while the patient is eating, or we made a mistake in doing our treatment, if there is an error or mistakes that happen during function of the patient after placing the treatment, then which do you think will break? Isn't it the one that will break is the natural tooth? Now, on the part of the dentist, they would prefer that. Why? Not because we like it, because we know how important the natural tooth is. We like it or we prefer it because we do not want to be blamed by our patient that our restoration is a failure. So we rather use a harder material and sacrifice the natural tooth rather than considering a material that is almost equal to the tooth structure so that it can preserve the natural tooth and allow our restoration to break instead than the natural tooth. See, that is the facts. That is why we prefer these hard structure materials, because we do not want to get blamed if something goes wrong. But see, that is the beauty of edelweiss. It will protect the natural tooth. If the patient bites or eat the food in a different or wrong way, the one that will absorb the force and the one that will fracture is the edelweiss and not the natural tooth, because the intent is to preserve and protect the natural tooth. That is how we should think of this material. and for us to be able to address the concern of our patient that, oh, it is not hard enough or our restoration is not good because it fractured. Well, you have to tell the patient that this material is being used because it has the closest characteristic as the natural tooth, and if something goes wrong, it will be the one to break. Okay, so next is, other thing is that we have to understand that, again, based on the intent on how the material was created, it is so thin. It is very thin. Why? Because the inventor or the one who created it wanted that we minimize tooth reduction when we do our treatment. The reason why zirconium, porcelain, these are good materials. Don't get me wrong. I use them as well. But we need to do a lot of tooth reduction in order to use them. See, they are protected with metal, and their strength is really strong. But see, it will need us to sacrifice a lot of the tooth structure during preparation so that it can accommodate the thickness of the material. So look at the veneer. You have a cervical area of 0.2 millimeters. That's how thin it is. Now, how come the incisal edge is thicker? Because that's where the stress-bearing area is. Sometimes I get amused when dentist tries to break the shell of the veneer of a device. Why are you doing this? You don't do like this, right? You don't break your tooth like this. So, and of course, as I've said, you cannot compare ceramics, zirconium, and the laser sintered vitrified glass edelweiss, because these are all different materials and all of them are good materials depending on what you are trying to achieve in your treatment. That's why earlier I said you need to know your purpose, the purpose of your treatment. Now, how long will it last? Now, honestly, doctors, we studied in prosthodontics that the longest is between 5 to 7 years. Now, what do you mean by the longest? Does it mean that it is already broken by 5 to 7 years? No. What we are talking about 5 to 7 years is the optimum benefit that restoration can give to the patient. Meaning, if, for example, you have placed porcelain in between 5 to 7 years, it is still well fit, looks good, there is no leak, probably if it is done well by the dentist. So it has the optimum features and benefit between 5 to 7 years. But after that, it deteriorates. Why? Because the patient grows old. The function, we do a lot of things. It has a wear and tear. So why are we, as dentists, sometimes I find it weird that we want the restoration to last 20 years. Of course, we want, as a patient, we would like to have that. But see, like you, me, we deteriorate, we grow older, we age, it changes. So between 5 to 7 years, if your our restoration are able to provide the optimum benefits to the patient, good for us, good for everybody. If it lasts on 10 years, even better. But nothing lasts forever. That is something that your patient has to understand, and and you yourself has to know that the optimum benefit of any restoration can only provide that to the patient between 5 to 7 years. That is the reason why you always ask your patient to annually visit your clinic so that you can check if everything is still working well, isn't it? So the next, does it stains? Now, honestly, it doesn't, because it is glass. the end result of edelweiss that came from composite resin that ends into vitrified glass, because the resin has been removed, it doesn't stain. Glass doesn't stain. So I can already tell you, because a lot of people shun away people who smokes. Now, me, I like to smoke. I'm so stressed. These days, I'm even more stressed than everybody else. So, so majority of the time, I like to smoke. And considering that I smoke, my edelweiss on the lower never stains. The one that stains is the natural tooth at the back. And I know that my edelweiss on the lower teeth has been there for 4 years already. See, that is why when you do prophylaxis, and if your patient is wearing an edelweiss veneer or occlusion VD or any restoration that is made by edelweiss in laser sintered vitrified glass, you cannot use your ultrasonic scaler. You can't, because it will scratch the glass. What you just need to do is just polish it. See, there is no, the only reason that there will be a stain is that if there is a leak when you cement the edelweiss veneer or occlusion VD. So as I've said, this is unified, wherein they are able to remove majority of the resin. The resin is the organic part of the composite resin, which really results to the absorption of the things that we eat, we drink, that can result to stain. Honestly, doctors, when I had my lower teeth done by Dr. Stefan for Edelweiss, he asked me if I wanted my upper to be replaced with Edelweiss as well. But as you can see, my upper is crowded, and I do not want my tooth to be reduced, because not all the time we can minimally do a tooth reduction. It really depends on the case. So when I said no, I said when I just get back, and if my teeth are already deteriorated, then I will have edelweiss placed on my upper. But you see, doctors, I regret that decision, because of course with composite or direct restoration, it stains. It doesn't look nice when I put my mouth mirror into it. Unlike my lower, I can talk and people can look at my lower teeth and it doesn't have stains, and it looks really beautiful. So the next question is, how much do I charge? Okay, so how much do I charge? So you can charge as much as you want. It doesn't matter. Some dentists, they make things life complicated. They will say, oh, I cannot charge it like this because it is composite, so I can only charge this amount. I mean, where do you get all those ideas? You are charging your fee not based on the material, but based how good you are as a dentist. What is your value as a dentist? So if you are charging patients based on the material you are using, then you are actually looking at the quality or talent of yourself lower, because you base you're charging through materials. So that's why when my patients sometimes ask me, how come, doctor, you are more expensive than this doctor? And I said, well, because you're paying me, you're paying my talent, and that shouldn't be based on the material. Okay. And another thing, as I've said, edelweiss, after it went through the process, is not anymore composite resin. It is laser sintered vitrified glass. So you can charge as much as you want, but of course, at least be reasonable about it, especially nowadays that life is really difficult and a lot of people has lost their jobs. So let us make it affordable by everyone. So another thing, I think this is the best material on this period of time, because you don't need to have a transmission or transition from the laboratory or for the patient to keep on coming back to your clinic. A lot of my colleagues, when they went back to practice, what they did is that if for one patient, they will already treat everything. No, they will already treat all the problem of the patient in one go, so that the patient doesn't have to keep on coming back on their clinic and have a higher risk of getting this virus. So in fact, this material is very ideal right now because you already have it in your hands. You can do whatever you want to do with it just as long as you follow its proper protocol and, of course, the right way of doing restoration. So you can do this by one appointment. So that is why I like this material, especially on this new normal. So how do you properly use this material? First is you have to make sure that you get the right size. Now, in terms of the shade, honestly, you don't have to complicate things. If you want if for example, the patient already likes the color of their teeth, then you just use the enamel shade. That is it. Enamel shade. Don't have to complicate so many things and stuff like that. That is the color that was placed on my lower teeth, enamel shade, because I like the shade of my teeth. I don't like the white as if it's a horse wherein the teeth is, in front of the face, like that, because it's so white. I don't know. Some of my patient likes the white, but they have to sign that they like that kind of thing, because most of the time when they actually see it, they will, okay, just a sec. When they actually see it, they will actually, uh, feel bad that that they've done that. Okay, so now I will show you the step by step. So first, get the shade, the size. So there is extra small, small, medium, and large. Then you can get the shade if you like, multi-layering technique in terms of how you cement it. But as I've said, if the patient is happy with the actual or original shade of his or her teeth, you can just use the enamel shade. Now, of course, you will have to create a shoulder. And again, when you create a shoulder, please make sure that it is supragingiva. It's not equi, it's not subgingiva, but supragingiva, a little bit lower than the gingival curvature. And then, of course, you are going to roughen up the shell, the back of the shell of the veneer or the occlusion VD, so that you will have additional mechanical retention. Now, in terms of etching, it is not that necessary. The only reason you etch is to remove the bacteria or to kill the bacteria or to clean the restoration, because sometimes it gets contaminated by your gloves or by other stuff in your dental chair or in your tray, that in the end can result to bacterial development. And this can happen not only with edelweiss, but this can also happen in porcelain, in zirconium, to the point that they will have a blackish discoloration of the gingiva. So you only etch because, as I've said, this is not porcelain, this is not ceramic. So the only reason you're going to etch is to clean it out. And then place a thin layer of the veneer bond. The veneer bond is available in the set of edelweiss, that you use a veneer bond because the veneer bond has silane and it doesn't have water or alcohol or the solvents that are normally used in a typical tooth bonding agent. And then now you prepare the tooth itself, okay, by etching it, okay, by etching it, and then There you go. This is the supra. And another thing, please do not reduce the incisal part of the tooth until it is actually cemented on the tooth itself. Now, of course, you can also reshape there. You can also reshape the veneer if you want it narrow, if you want it wide. Now, unfortunately, because of the pandemic, there is no, you know, workshop training, but we do offer that later on, hopefully, once we are able to travel. And then what is nice about Edelweiss is you can actually do a mock-up. As I've said, you can do direct, indirect, semi-direct. So you can actually check if it fits well on the cast or on the tooth itself. Okay, so once everything is good, then now you can actually cement it. Okay, you can also use the mock-up as a marketing tool. Now, as I've said, you have to roughen it up. This part is if you want to create a certain characteristics by doing mamelons, then that you can also do. You can do advanced technique of how you do it. Okay, so there you go. You roughen it up. And then please make sure that there is a bowl or a cup because it is so thin and sometimes your gloves became very slippery to the point that if you wash it, it might drop somewhere. So it is best that there is a cup that is, beneath it while you are washing it so that in case of, accidental dropping or dislodging while you are cleaning your edelweiss veneer or occlusion VD, it will fall into the cup. It will not, you don't have to search it on the floor. It happened to me when I was doing a patient, and then of course because it has a cause, we tried to look for it, and the patient was looking at me like I'm some kind of a weirdo because in the mind of the patient, what are you trying to do? Are you trying to find that shell and place it in my mouth after falling into the floor? So again, that is the best way. So you have to place a cup. And by the way, edelweiss is autoclavable. That is why if you want to mock it up and have a testing done on the patient, you can do so and allow the patient to see what is the after effect. And then if the patient didn't like it, or if there is no if it is not the right size, then your assistant or you can just remove the composite. When you are marking it up, you don't bond, you don't etch, you don't do anything. You just use a ball of composite. And normally when I do a mock-up or a testing, I use an expired composite so that I will not be wasting the material. So I will just stick it on like a sticker, so, and then allow the patient to see it and can comment what kind of shape, size that she would prefer. So then, of course, once you place the veneer bond on the shell, then you cure it. And then you place a celluloid strip. Now, again, this is very little techniques that you need to remember. Do not use celluloid strip, the cheap ones who are very thick and very hard to bend, because this can cause an overhang on the cervical area. Plus, it does not allow you to really make sure that there is no leak on the cavo surface margins between the tooth and the restoration. So again, try to invest in good materials. So get a nice celluloid strip that you can bend and blend. Then, of course, you need to etch the tooth and then wash it. Now, remember, as much as possible, even if it is not edelweiss, it is always advised that you end your veneer preparation on the enamel. That has been taught several times in our school. So if it is possible, you have to end your restoration on the enamel, because on the enamel, bonding is much better. However, most of the time, we end up preparing the veneer prep up to the dentine. Why? As I've said, because we need to accommodate the material that we are planning to use, like porcelain or ceramics. Okay, so of course you wash, you cure, and then of course when you handle it, make sure that your gloves are clean, because we do not want to transfer anything from our gloves to the material itself that we are going to use. Now it is very important that when we cement it, we try to roll the composite in our thumb and index finger. Why? So that the composite will be compact once we press. Now remember, the edelweiss, we do not cement it with luting composite. We do not have to buy a special cement just to cement it or bond it on the tooth. You will use your regular composite resin. However, of course, there must be a good quality of composite resin, and we do advise that you use the edelweiss composite. Okay, so and then you try to pack it. Now again, you don't need to have an extra holder just to transfer the edelweiss and cement it on the tooth. You can just use the interproximal carver and stick it on the composite, and then carry it on the tooth structure for cementation. Now, this style is doing the multi-layering technique if you want a bit of character, especially if your patient wants it whiter. So you can have 2 shades or 3 shades technique, because as I've said, you are using a regular composite, so you can play with it. That's why I really like this material. Whether I work for Edelweiss or not, I will still recommend it, because precisely it is very flexible depending on what you are trying to achieve. So if you want 2 shades, fine. If you want 1 shade, fine. See, like this, you are trying to create a mamelon, so you have 2 shades. You can have the main shade, the dentin shade, and then of course the incisal shade on the incisal area. So you create it and you place it. You can even use tints if you want to. So but if you are lazy, again, as I've said, you can just use the enamel shade, and it will actually transmit the actual color of the tooth on the edelweiss. This is also the best material for single restoration. We all know how difficult single restoration is, right? Because in single restoration, we need to copy exactly the shade of the adjacent and the opposing tooth, so that it will blend well when your patient smile, and that is very difficult. It's much easier to do multiple restoration because we can choose whatever shade we want. But with single restoration, we need to copy it exactly as it is. And that is why I like edelweiss, because if you edelweiss is translucent, and if you use the enamel shade of edelweiss, which is also translucent, the shade of the natural tooth at the back will actually reflect in the front. That is why, if after this pandemic you get to meet me, you will not notice that I'm actually wearing a restoration on my entire lower. Normally, dentists can figure out if you are wearing a crown, a veneer, or whatever. Why? Because it's too opaque. So like this, so you can actually place it, and then once you position it properly, don't fully cure it, just point cure it on the edge, okay, so that the other excess of the composite is still malleable and you can still play with it, but the edelweiss veneer will not be moving anymore. So you want it fixed, but at the same time, the rest of the composite that we use as a cement is malleable enough so that we can still seal, the edges, and make sure that, we are totally sealing the entire restoration. So as you can see, it is very malleable. And then once we are able to already create the satisfied cementation, then that's the time we fully cure. See, now, if in case, no, a lot of dentists will ask, what if there is, on the cervical area, it doesn't, totally seal the area, because the cervical curvature may have different shapes? Well, you can also do a composite buildup on that area, or you can use a flowable. However, doctors, if you are using composite to build up, whatever material that is not covered by edelweiss, because sometimes the shape and the size of the teeth is weird, and there's no because the edelweiss is shape and size in general manner. So if you cannot, totally covered all the surface and you want to totally seal it, the only problem with that is that that part that you build up with composite will later on stain, because that is composite. But the one with the edelweiss, it will remain the same. So you just fully cure it, and then that's the time you try to adjust the incisal edge. You can soften it up, and then please make sure there is no premature contact. You polish it very well. And as you can see, once you are able to done it, that is how it looks. Okay? Now, another what I love about Edelweiss is this is the one thing that actually provide me so much, possibility of earning is through amalgam replacement. The thing is, I love direct restoration. It's easier. We are used to it. That's fine. But the thing is, because of the pits and grooves and the fissures that we are trying to build to make it look natural, later on when it stains, it doesn't look nice. Unlike a device, as I've said, it doesn't stain. So if unless it fractures, and if it stays put and it's totally sealed, it really looks nice. I am telling you, because when I look at my teeth, and especially nowadays, it's very hard to go to my own dentist. So at the end of the day, I appreciated that I had edelweiss done on my lower teeth. Okay, so material I feel is underrated. A lot of dentists are not able to appreciate it because, again, they make things complicated. All you have to do is really just remove the amalgam. Sometimes that I even have one restoration that Dr. Stefan did not remove all the amalgam, because sometimes if we remove everything, the tendency is we disturb it and even creates more problem than solution. So what we did is that he placed a veneer band on the metal, cover it with an opaquer, and then put an occlusion VD. And up to now, I have no problems with it. So the same as the veneer, you just roughen it up, and then remove the debris, and then place the veneer bond, okay, and then cure it. Now, once it's cured, okay, now you will roll a composite. This is the first step so that you will get the actual shape of the tooth of your patient that you are restoring. Okay, so on the tooth itself, you do not etch, you do not bond, you do not do anything. Okay, and then allow the patient, once you place the occlusion VD, allow the patient to bite slowly. So the ball of composite at the back of the occlusion VD will now spread and will act like a rubber impression, wherein it will now get the impression of the tooth you are trying to restore. So that because of course, with the occlusion VD from the manufacturer, it has a general shape. So once you are able to do that, then now it is time to etch, bond the natural tooth, and now place another ball of composite. But this time around, you are going to put it on the level straight. You do not place it on the tooth like a ball already, but you still ball you still roll the composite, okay? But you spread it all over the back of the occlusion VD, and now press it. Make sure it is, well fitted. Remove the premature contact, remove the, make sure that it is totally sealed, and then polish, finish, and that is it. So it is really as simple as that. But sometimes dentists, again, makes it complicated and think blah, 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 so many uh, reasons that they are trying to give in order not to do what needs to be done. So another thing is porcelain repair. Now, a lot of dentists will say, why do you need to replace it? With occlusion DD, try to restore a porcelain when you can just replace the porcelain. But you see, just like me, I don't like, the removal of my previous porcelain, especially if it's still well fit. Now, you can do porcelain repair if one, it is still fitted, two, the tooth doesn't have a recurrent caries. Okay?